You are listening to You Restored with Dr. Kelley Reis. To listen to all episodes, visit libertynaturalwellness.com. On this episode of You Restored, we're going to dive into thermography. Thermography, also known as digital infrared imaging, is a tool that I have used for we're going on 15 years. It is such an amazing tool, guys. I use it for all types of clients. It is this really cool screening tool. A lot of people think it's a diagnostic tool. It is not a diagnostic tool. It is a screening tool. So it is like you would think of as a mammogram or an ultrasound or something like that. Those are all screening tools. So thermography falls in line with those. But I've used it for 15 years, helping my clients figure out what might be the root of all of their problems. One example would be somebody has pain. Maybe they have leg pain. So we do imaging and it's looking for, could this leg pain, it teases apart, could it be nerve? Could it be muscle? Could it be blood vessel? Could it be bone? Could it be joint? That's how cool thermography is it really helps to tease apart, like pain origin, for example. I want to give you guys two really interesting examples of how thermography has helped my clients. I have numerous, hundreds and hundreds of examples, but I have some ones that I want to share. Client comes in, chronic sinus infections. And she has been through all the antibiotics and she has been through all of the nasal washing and nasal lavage and they've done even head CTs and could not figure out why they couldn't get rid of the chronic sinus infection. So we did a head and neck imaging. It's not always about breast thermography. We did head and neck only. So we do front of the face, we do sides, we do at an angle, and I also look at the back. And lo and behold, I see this tooth abscess. It was glaring on thermography. Glaring. I said, ever have a root canal or anything in this area? And she's like, I did. So what does she do? She goes back. She happened to be a dental hygienist, so that was fortunate. She goes to work and she asks them to angle the x-ray in a very specific way, a way that they would never do normally. And lo and behold, they found the abscess. The abscess was treated. Guess what? Sinus infections, those chronic sinus infections went away. It was a tooth issue the whole time. This was way back in the beginning of when I just started to use thermography. What a cool tool to find that they were treating the wrong thing. Now, I want to tell you about another client. This was a virtual client, did not see her in person. And she was suffering with bloating. And she had been to the gastroenterologist. She had been all over the place. And she was 70. Nobody could figure out what was going on. So I suggested that she get thermography and that she send me those images and their interpretation. Now, I'm very particular about the type of thermography equipment that one should use. I'll get into that in a little bit. But she had imaging done. She sends me those images and I was shocked. Number one, these images are on a black background. So they're really glaring when you see them because it really outlines the body in a way that you don't see when it's not a black background. Her bloating was enormous. And I can't believe that a gastroenterologist wouldn't look at her and see that that was not normal bloating. But it showed gastroesophageal thermic intensities. So I immediately had her go and report into the emergency room to get an ultrasound, a scope, whatever they could do. Her bloating was not normal bloating, especially for a 70-year-old. Not normal. And unfortunately, it turned out to be late stage esophageal cancer. Thermography helped pinpoint where that cancer might be, but that bloating was my first. The bloating, the size of her abdomen, you could tell she was a very thin woman. The size of her abdomen against that black background, she looked pregnant. She looked 7 months pregnant. And that no doctor really looked at her, touched her, even thought that that was abnormal was appalling to me. But thermography helped pinpoint where we might want to start looking, because a bloated belly like that could be gynecological types of cancers. It could be liver. This turned out to be esophageal. Now, not all bloating is cancer, but for a 70-year-old woman with the extent of bloating that she had, that was very alarming to see. So thermography was really, really helpful in getting her treatment that she needed, but really identifying the area of concern. Thermography, I mentioned leg pain. Sciatica shows up very interesting. So people may not know that they have a sciatic nerve issue. It shows up differently. A lot of people think that thermography is based in looking for hot spots. That is not really the case. While to an extent hot spots matter, it's not really what we're looking for. Now, when I do the imaging, I submit those to a clinical thermologist. This is a board-certified MD who is trained in thermology. So like a radiologist is going to interpret your x-rays and CTs and all of that, a thermologist is an expert at interpreting a thermogram or thermographic imaging. Now, I mentioned that hot spots and that's not really what we're looking at. This is where it gets really interesting. Back to good old sympathetic dominance, autonomics, sympathetic nervous system. So every organ in the body has these micro nerves that actually, they innervate the organ, but they also have a presence on the skin. Thermography isn't seeing inside, like deep inside the body. It only sees the top 5 millimeters of skin. But the cool part is, when an organ is inflamed, or say there's a tumor or some type of hernia, for example, like where temperatures, there's like a twist in the colon or small intestine, or something's pressing on something, that sends a message through the nerves to the skin. I think that's the coolest part of thermography. So we're not seeing deep, deep, deep into the body. We're seeing 5 millimeters of skin. So if an organ is inflamed, that actually causes these nerves send a message to the skin that either vasoconstrict, that's squeezing the blood vessels, those micro blood vessels in the skin, or vasodilates, opens. So when it vasodilates, we see the warmer colors. We see the yellow, the orange, the reds, and the hottest is white. But sometimes a compression like a nerve, like sciatica, that nerve compression doesn't manifest as inflammation. It manifests as vasoconstriction of those blood vessels on the skin. So we actually see blue and black. So I always let people know, don't always think we're looking for hot spots. That is not the case. A board-certified clinical thermologist, they are looking at temperature differences between the like side, so right and left hand, or right side of the abdomen, left side of the abdomen. And they are looking for asymmetries. So there's a certain map on the body that how the temperatures should look under normal, air quote, normal circumstances. I don't think anybody's really normal anyway, but there's a map of how organs manifest to the skin through those micro nerves and micro blood vessels. So there's a real big talk with the body and how it manifests on the skin. So thermography is assessing these board certified clinical thermologists are interpreting temperature differentials, minute temperature differentials, and assessing whether or not that is a physiological issue, a neurological issue, or is that within normal limits that we would see. And then we get a phenomenal printout of the interpretation and the thoughts of the clinical thermologist as well. So a lot of people think that this is just about breast thermography. It's best known for breast, but it's apples and oranges when comparing thermography to mammograms. Mammograms looking for a structure. It's got to be closer to pea size. Sometimes they're looking for calcifications. Calcifications don't always mean cancer, but looking for a structure. Thermography is looking for a physiological or neurological process that is happening that could create the structure. So thermography doesn't see a tumor. Thermography sees inflammation in an organ that isn't right, and that manifests to the 5 millimeters of the skin surface. That's really important to understand that. But breast thermography, it's not apples and oranges. Honestly, most people who come to me for breast thermography, they are not interested in mammography. I'm a medical freedom advocate. You get what you want. Just make sure you're educated and make sure you do something. I think thermography screening's great, but we do so much more than just breast imaging. Like I said, head and neck, I do full bodies. I do just female or male screens, which is pelvis up to the head. We get thyroid. It's really interesting for thyroid dysfunction, carotid artery disease. It can pick up carotid artery blockage at 20% blocked, where a Doppler ultrasound doesn't see it until 60. That's happened a number of times over the last almost 15 years. So we're looking at really picking things up early, right? We want prevention. We want to see things before they happen. Thermography is only as good as its next thermography. What I mean by that is thermography needs a baseline. A baseline is get imaging, get another set of imaging 3 months later. And then from that point on, we're comparing all the images to one another. Change in temperature of the skin can indicate change in what's going on underneath or inside. Thermography isn't a one shot. A lot of people will be like, oh, I have a lump in my breast. I want thermography. I'm like, well, doesn't hurt to get a breast ultrasound in that case, because we need to wait 3 months really to see if there's any change. So I'm a big advocate for breast ultrasounds in that case to see, because after a mammogram, if there's something concerning, they go to a breast ultrasound anyway. So advocate for a breast ultrasound if you ever have a lump. And, thermography is great in mapping, but in that situation, we need a little more quick response to check into that. So the FDA, not going to lie, they do not like thermography. And if you're listening, FDA, it's okay. You know you don't like thermography. So it's cheap / inexpensive, doesn't cost a lot. It's not invasive. It's not zapping you with waves. You're not getting, x-rays, and there's not trauma to the breast. The camera doesn't touch you. And it's, like I said, apples and oranges, but it's a really wonderful screening tool if you do it correctly. So I use Meditherm. Meditherm is the only medical grade camera system out there. They have the superior clinical thermologists who are doing the interpretations. Their system is stellar, but their camera is unmatched by none. Like no one matches the quality of the Meditherm camera. It was a military camera that was fine-tuned to be medical grade. So what makes that special is the less expensive, less quality thermography cameras will look at temperature differences between 1 to 3 degrees. Meditherm will look at temperature differences or differentials to the 1/100th degree. That is dramatically significant. So we're picking up really discrete temperature changes or differentials from one side to the other, or from what it's supposed to look like, what is a normal thermographic pattern. Meditherm, unmatched when it comes to quality interpretation. So I always recommend Meditherm. If you're getting thermography anywhere, you could get thermography anywhere in the world. If someone uses a Meditherm camera, they're going to compare your images from wherever, whenever you've had them before, if you've been in their system. And there are people all over the world who are imaging. And so that is really, really an awesome aspect to the Meditherm system, because there's not a lot of connection with the other systems that aren't Meditherm. You can get thermography with a FLIR camera from one person in Florida and then go to Oregon and get one with a FLIR camera, and they're not compared. But Meditherm, always compared. Your images are always compared. And that 1/100th of a degree in temperature change is crucial when it comes to the interpretation or picking up things early. That's why we do thermography. I recommend it all the time to my clients when we have something that we just can't pinpoint. We just can't pinpoint it. It shows early heart disease risk, like I said, thyroid dysfunction. We have breast patterns that can point to estrogen dominance, but there's a really interesting pattern with one of my favorite topics, sympathetic dominance. The nerves are all sympathetic based. And thermography is looking at vasoconstriction or vasodilation as it relates to sympathetic dominance overdrive. You can have patterns in your gut that are representative of sympathetic dominance. You can have in gynecological areas, so pelvic region, sympathetic dominance, adrenal area, sympathetic dominance, head and neck. We can put a lot together when it comes to using thermography as a tool. I love the interpretation that it comes with, because 15 years into this, I'll never interpret my own images, because I love those board certified MDs who the clinical thermologists. They give stellar interpretations, and that makes all the difference, because it helps me figure out, put some puzzle pieces together. So if you are around someone who offers Meditherm thermography, I highly recommend it. Even if you feel great, I recommend it as kind of a map. You can map your body once a year. Doesn't harm you. Like I said, there's no x-rays. We're not worried about anything like that. And it gives great data. So you're mapping once a year. Oh, look at the changes starting to happen in my breasts or in my thyroid or in my abdomen. My liver's getting agitated. We can always follow up with lab work, Dutch testing, GI maps, all that stuff, of course. But this is a really wonderful tool to map the physiology, neurology, inflammation in the body. I'm Dr. Kelley Reis. This is You Restored. Make sure you're doing the real work.